The Honorable Madam Speaker.
No quorum.
Upstairs good, Madam Speaker. I said the food upstairs good. Sushi.
Leader of the House.
Thank you very much, Madam Speaker. Madam Speaker, I beg to move that this House to now adjourn to a date to be fixed. Thank you.
Honorable members, there are 3 matters that qualify to be raised on the motion for the adjournment of the House, filed by members of Pointe-a-Pierre and Caroni East. May I ask the acting whip if they intend to proceed with all 3?
Madam Speaker, thank you. We intend to proceed with matters of number 1 and number 2.
Thank you. I now call upon the member for Pointe-a-Pierre.
Thank you, Madam Speaker, for allowing me to raise this matter on adjournment. Madam Speaker, each year, the health and well-being of thousands of residents from communities such as Springvale, Claxton Bay, France Gardens, Diamond Village, Cedar Hill, Phoenix Park, and Windsor Park are negatively impacted by the excessive smoke that emanates from the Forest Park landfill due to fires and poor maintenance. Madam Speaker, let me firstly sincerely thank you on behalf of the citizens of Pointe-a-Pierre and environs whose lives have been and continue to be negatively impacted upon by the fusion of health and social issues as a result of these hazardous conditions. Madam Speaker, there's a time for politics while there's a time for progress, and this happens to be one of those times. At times, we may differ from those opposite to us. However, collectively as a parliament, we all have a responsibility to each and every citizen of this nation, which is preserving and protecting their welfare as we ensure their safety. Thus, this is not a discussion about what was done or not done, but rather a discussion on how we as elected representatives can all work together to enhance the lives of the group of individuals who are facing dire constraints. Every dry season, Madam Speaker, residents prepare for a grim winter of thick smoke and toxic odors which enter their homes and living spaces within hours of the start of a fire within the dump. This smoke and odor, Madam Speaker, which takes hours to trap the residents in their homes, prolongs for weeks, causing respiratory problems, headaches, and other illnesses. Madam Speaker, the common claim by residents when they visit my constituency office for assistance, it is like hell. I would like to quote a resident: anyone who wants to get a taste of hell can visit Springvale, Claxton Bay at any time, whenever the nearby Forest Park landfill is ablaze. During these horrific periods, some demographics that are greatly impacted are the most vulnerable are babies, young children, and the elderly. Madam Speaker, many couples are often forced to relocate temporarily with their babies during this period, as these conditions can prove to be quite fatal to the newborn. The effort of relocating can be arduous to the families as they have to split up or even pay a rent for another home until the condition subsides. This impact on the elderly, Madam Speaker, is also quite grim, as with babies and young children. Many senior citizens are affected by severe respiratory afflictions, which results in many acute complications given their age. Many of them, Madam Speaker, are forced to lock themselves into rooms with fans in an effort to escape the smoke. Families with heart patients also become very anxious at this time given the vulnerability of their loved ones. The plight of heart patient Ashmeet Ghani, a constituency member, was expressed in an article published in Trinidad Guardian on March 16, 2016, entitled "Burning Dumps Leads to Cancer Classes." Ghani, age 51, suffers from cardiogenic pulmonary edema, a condition where water gathers in the lungs. He also suffered a major heart attack and as a result was forced to install a pacemaker. Living opposite the school, he stated that he had to use a nebulizer as he was unable to breathe properly due to the large volume of smoke in the atmosphere. Residents such as Christine Charmaine of Springvale, a mother of two who suffers with asthma, has been hospitalized many times in the past, which has affected her working patterns as she is forced to recover. Ms. Charmaine, like many other asthmatic patients, has resorted in staying by friends outside of this area. Madam Speaker, one can therefore sympathize with the traumatic and possibly fatal health issues being faced by residents. But it goes further than this, Madam Speaker. The communities are also experiencing repercussions on their social fabric as the education of the children are being impacted. Madam Speaker, the Springvale Hindu Primary School, which is comprised of over 200 students, is affected each year as it is located in the course of the wind direction. Annually, the school is forced to shut down due to students having to be rushed to the hospital with asthma attacks and other respiratory issues. This has made it impossible for the efficient exam preparation and consistency for study. Having just described the tip of the iceberg of negative issues due to poor maintenance of the Forest Park landfill, one can see why this motion is so critical to many citizens. Madam Speaker, this is an issue close to my heart because during my campaign last year, and presently as I serve my constituents, I gained first-hand experience and knowledge of the situation. It hurts to see the turmoil they face during this ordeal. Madam Speaker, when you look at the pain and agony in their face on my constituents that they have to endure. Therefore today, Madam Speaker, I have brought this motion in an effort to bring relief to those families already struggling financially, but are now forced to pay rent for alternative accommodation so as to protect the health of their children, as well as increase medical costs. Most importantly, I brought this motion for the children of these communities who deserve to be outside enjoying the recreational games just as any other child throughout Trinidad and Tobago. The moral test of a nation, Madam Speaker, is how it treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped. Therefore, we as a parliament must reflect on our own families to best understand this issue and create the will to rectify the situation. As representatives of the people, we must all reflect and ask ourselves, would we be happy if it were our children, babies, breathing this heavily polluted air? Would we be comfortable if it were our own parents suffering from discomfort? Would we be happy if it were our homes, our escape from the hustle and bustle being invaded by toxic smoke and odor? I am certain the answer would be all in the negative. Thus, as the local saying goes, what we don't want for ourselves, we must not want for others, especially those who we represent and serve. Madam Speaker, doctors have confirmed a number of health-related issues that occurred in individuals who live close to landfills and have been impacted by the smoke and odors of these landfills. Some of these include, Madam Speaker, cancer, low birth weight, and the impact of the children as far as reports have shown shorter stature and slow growth among the exposed children. Madam Speaker, the Pointe-a-Pierre constituency and environs, like Tabaquite and Couva South, already has the presence of Petrotrin and Trinidad Cement Limited, coupled with a high percentage of children suffering from Down syndrome and autism. Therefore, these health risks posed by the landfill makes the scenario even bleaker. Madam Speaker, Madam Speaker.
Is there a link you're making? Is there a link between? Is that a link?
Yeah, I'll link it. Which one? Which one? The autism?
Point of view, please continue the contribution directly this way.
Member, please.
Sure.
Are you making a link between the fumes and the cement and all that with autism and Down syndrome?
Madam Speaker, what I'm trying to say is that in my constituent point of view, we have two major corporations, Trinidad Cement Limited and the Petrotrin Corporation, and they emit toxic fumes in the air along with the landfills. And we have a very high rate of autism. I'm not linking it to. I'm just saying that we have a high rate of autism and Down syndrome children in my constituency. Madam Speaker, it is important that all possible steps are taken to relocate this site. I therefore make a plea to those in authority on behalf of the thousands who suffer each year that they will do all within their remit to alleviate this situation. These residents cannot go another year facing these strenuous circumstances. Each time they are faced with this situation, they are burdened financially, socially, emotionally, and physically. I am aware that the closure of this site will not be a short-term measure. However, in the short term, I am hoping that the government of the day will try to implement new strategic measures aimed at effectively managing waste at this site and preventing fires from occurring. Madam Speaker, we often speak about diversification and investing into new resources to encourage national development and national growth. However, the greatest asset we can invest into a nation, be assured of dividends as well as benefits, is our human capital. Today, Madam Speaker, we observe Earth Day, and I therefore ask this Parliament to give the people of Springvale, Caxton Bay, Prance Gardens, Diamond Village, Cedar Hill, Phoenix Park, and Windsor Park a true and fair opportunity at achieving their full potential by enhancing their living standards. Madam Speaker, I thank you.
Minister of Public Utilities.
Madam Speaker, thank you for the opportunity to respond to this motion. Madam Speaker, the Forest Park landfill was established in 1983, the country's only partially engineered landfill. So this landfill has been in existence for quite a number of years. It covers 22 hectares and handles approximately 503 tons of waste per day. Now, so your fires at landfill sites occur spontaneously, especially during the dry season. The occurrence of fires are also heightened when persons indiscriminately burn items close to the fringes of the landfill sites, and these fires spread to the landfill. Madam Speaker, it was ascertained that on Monday, the 14th of March, 2016, at around 4 a.m., there was a surface fire at the Forest Park landfill that escalated due to the strong downwinds. This caused embers and burning foliage to rapidly spread to the northern face of the landfill onto uncovered waste. The landfill uncovered waste served as fuel for the fire, causing it to burn rapidly and intensely, spreading to an area of approximately 6 acres, producing significant smoke impact to the downwind communities. This portion of the landfill, due to the steep terrain, was not covered, and as such, the exposed garbage easily ignited, and the lingering, burning smoke lasted for over 6 days. The fire produced significant smoke, and impacted the site office area, Kangarwood Road, and downwind communities in Springvale, particularly the Springvale Primary Hindu School. Madam Speaker, SWIMCAL's emergency teams were immediately activated and mobilized its on-site heavy-duty equipment, cover earth material, labor, and other resources to combat the fire. The staff of SWIMCAL, together with the site contractors, worked into the night to contain the fire. Madam Speaker, prudent site management by SWIMCAL has relocated the current tipping area to a site downwind of the communities, and a berm has also been built to act as a fire break to prevent future spread of fires from bushfires in the surrounding areas. They have also been working closely with the Disaster Management Unit of the ODPM to look into short-term remedial action that can be taken. Madam Speaker, air quality monitoring was conducted by SWIMCAL's Environment Quality Officer and also an independent third-party testing firm. Testing was done in the Springvale community. One testing station was set up at the Springvale Primary Hindu School, as this was one of the vulnerable areas. All results indicated no elevated levels were detected. SWIMCAL, along with the ODPM and Red Cross, conducted a walkabout in the Springvale community to gain feedback from the residents. The team also met with the teachers and parents of the Springvale Hindu School several times. While the air quality testing was favorable, there would have been intermittent periods of acute smoke impact, especially on children and persons with pre-existing medical conditions. All nearby public medical facilities were alerted to the situation and informed to treat with priority persons coming in for smoke impact from the Springvale community. Madam Speaker, unfortunately, because of the very nature of landfills, spontaneous subterranean fires will still occur, especially during periods of extreme dryness and heat. Madam Speaker, SWIMCAL has many positive measures on fire mitigation in place during the recent fire at the Forest Park landfill site. SWIMCAL had an emergency management plan in place, in addition to a landfill fire prevention, control, and mitigation plans. The availability of SWIMCAL's on-site emergency equipment and material facilitated a quick response to the fire. SWIMCAL has cover material at strategic locations on the active tip area, contributing significantly to the rapid response in combating fire. And this is part of the response that SWIMCAL will have material on site to move swiftly to deal with any occurring fires. A good response time by SWIMCAL's emergency response team was evident. Additional labor was quickly mobilized within 1 hour's time to utilize on-site equipment. Madam Speaker, SWIMCAL is currently working on plans to upgrade and convert the Forest Park site to a fully engineered sanitary landfill according to international standards. The design of the new engineered site at Forest Park is scheduled for this fiscal year. Madam Speaker, following the last incident, SWIMCAL has also been working with the school to seal the classrooms and provide the necessary infrastructure so that smoke does not enter the buildings in future. They have also worked out an evacuation plan with the school in the event that a fire or other disaster forces the closure of the school in the future. I sympathize with the Member of Parliament for Point-a-Pierre in terms of the situation with the landfill, but as was pointed out, what he's saying about linkages between the smoke from the landfill and certain afflictions of the population.
That's long problems. It does affect the lungs.
I do agree. So I'm thankful for the correction in terms of the linkages. But yes, I do concur that the smoke will affect the citizens, and especially the school children, the aged and the infirm. The intention is to deal with the landfill, and the intention is to have a holistic approach in terms of the entire waste production and the dealing with the waste products. The intention for Swimcul to go into recycling in terms of the landfill, and in the future, the landfill would be more modernized to deal with situation and to eliminate the problem of fires at the landfill. Thank you.
Member for Caroni East.
Thank you, Madam Speaker. Thank you for allowing me the opportunity to present this motion on the adjournment this evening. It's a motion on the issue of the health sector, a very disconcerting issue now, particularly a number of vacancies are not filled in the health sector. While we need more human resource personnel in the health sector, we find that they are not being filled to the extent that we need to continue to provide improved managed health care in the country. And this really will affect from the newborn to the child, to the adolescent, to the adult, and to the senior citizen. To speak about the vacancies as a whole and all aspects of vacancies in the health sector will take a long time, but I want to focus this evening on one particular area, and that is the vacancies existing for the newly qualified doctors in Trinidad and Tobago. Madam Speaker, I have been advised that there are close to about 150 doctors who are waiting for jobs some from as long as the 1st of July last year, and some from the 1st of January this year. And I've been advised it's close to about 150 doctors who have finished their internship programs and are now waiting for jobs, for some now 10 months and some 4 months. So it's important for the Honorable Minister to give us a true perspective of why these doctors who have been qualified and spent 5 years in medical school, a year and a half doing their internship and being trained during the internship program, some as much as 2 years. I'm advised by my colleague, Dr. Khan, member for Sama Barataria, that some of the internship programs are 2 years. So here it is, a year and a half, 2 years. Not in Trinidad. Not in Trinidad. Some are here in Trinidad waiting for jobs, having completed their internship program. So we have a situation, Madam Speaker, that we have 150 trained doctors unemployed. And while the minister says that they're looking for human personnel, they cannot open the Couva hospital because of lack of personnel. Here it is presenting that we have 150 doctors, and they can readily take up positions within the health sector. In addition, at the end of June this year, we expect about another 100 doctors coming out to be from the internship program to be house officers. The hierarchy of it is you do internship, you become a house officer, then a junior registrar, and a consultant. And so we have vacancies in consultant positions, vacancies in registrar's positions, vacancies in junior registrars, but more critically is why are these 150 doctors, and on the 1st of July, there's going to be approximately 250 doctors, I'm advised, who are needing jobs and are not obtaining jobs. Most of these doctors who are waiting on jobs have been island scholarship winners, additional scholarship winners, and they have been funded by the GATE program. And to fulfill their obligation from having received an island scholarship, my understanding is that if the state does not provide a job for you within 6 months, you do not have to complete your obligation for it. So here it is, the state spent millions of dollars educating these doctors, and the state now is not in a position to offer them employment. Why are they not being offered employment in the 4 regional health authorities in Trinidad and 1 in Tobago? My understanding as well, I've been told that the regional health authorities are not given the money. And this is for the Minister of Finance to answer whether the regional health authorities have been given the money that would allow the regional health authorities to employ these doctors. Now, these doctors are well-trained doctors, and if you do not give them employment, they will leave these shores. You will have the best doctors leaving the shores. So if you want to have health tourism, which doctors will come, which patients will come if you do not have the cadre of personnel that you have to train to become the best? And here it is an opportunity that these 150 doctors or 250 doctors need to be continuously trained to build the cadre of the health profession and the health professionals so that we can boast and have some of the best doctors. Most of our professors now at the University of the West Indies are homegrown doctors who have trained here and abroad and developed the skills and competencies and have been brought to the position to become professors of the university. So if we are to continue this, why are we not providing the employment and the skills training that these doctors need? Because once you stop working as a doctor, you lose your skills. And 10 months is too long for a young doctor to be waiting there for a job. Some of their parents invested millions of dollars on them to get their profession, and they are not being employed. So we're talking about health tourism. We're talking about private sector, public sector partnership. How can we have private sector, public sector partnership when we do not have the cadre of trained doctors in the country? Madam Speaker, so we are losing the best to the metropolitan countries. We are weakening the human capital base for our country in terms of having the best doctors to deal with our patients. They need to continue the training, and we have competent people to help them continue the training. The foreign countries, United Kingdom, Canada, and United States have closed their doors to our doctors. It takes a long time for someone from Trinidad to be able to get a job internationally. So where do they have to get their further training? Right here in Trinidad and Tobago. And so it is important that we provide the opportunity for them. So it's painful. I have a colleague who has been my anesthetist from 1981. 35 years he has been my anesthetist. 2 of his sons are trained as doctors. One had to leave and go abroad. The other one is waiting for almost 6 months to get a job now in Trinidad. So he is one of the parents who has asked me to raise this issue to the Minister of Health, to the government. Why are these doctors not getting the opportunity to serve and fulfill their obligation under the scholarships? So it's important my understanding is that the money is not even provided for reagents for doing little blood tests in the Southwest Regional Health Authority. So you have half of the population of Trinidad and Tobago who are at risk. God forbid something happens to one of them and they have to go into the hospitals in South. They don't have the reagents to do simple blood tests. So how can a doctor make a diagnosis when you can't do a simple blood test like a complete blood count or a renal function test or a liver function test? So it is affecting the healthcare. Listen, we in all of this together, we want to see the best for our people of Trinidad and Tobago. We want to provide the best healthcare for everyone. So it is important that the government decides what they want to do and do what is appropriate and do what is right. Madam Speaker, it was our founding father of Trinidad and Tobago, Dr. Eric Williams, who wanted the University of the West Indies in Trinidad open a medical school Dr. Williams said that UWI Jamaica was taking 120 plus students, and Trinidad was only getting 25 students per year. I was one of the students in 1973. And he became angry and he said we must open our own medical school. And he ensured that with Professors Bobron and Bartholomew and Rolf Richards and a whole team of professors, in 1987, the NAR said, you can open the medical school, we're not going to give you money. So we had to take in students from Manipal. I was one of the founding people there. I was younger than the other professors, but we opened the medical school in 87. It's now 29 years old, doing very well. We're producing some of the best doctors in the world. So we have to take care of them and continue our contribution towards the development of healthcare in Trinidad and Tobago. The Minister will have the opportunity to give us a broader picture, if he wants, about the vacancies existing for nurses, nurses' aides, and paraprofessionals in every other area. But I had to focus on these doctors who are crying out loud, what are we going to do? We don't have a job. We're losing our skills. We don't have training. And the country is suffering from deteriorating healthcare. Thank you for allowing me the opportunity for response.
Minister of Health.
Thank you, Madam Speaker. Madam Speaker, today confirms why a doctor should not be the Minister of Health. Because you brought a motion and you did not quote one statistic to back up your argument. So let me educate the House on the statistics that are relevant. Teach them. House officers, vacancy rate by category, 2015, 19%. Went down to 9% in 2016 under our stewardship. Graduates from the universities of the West Indies, 2011, 174, 2012, 190, 2013, 235, 2014, 205. Given the above rates of graduation, there appears to be a very adequate supply of doctors needed for the demand estimated over the next 5 years of 1,329. So you have enough house officers. You may even be having too many interns to get into the public healthcare system because the vacancies have been filled at that level. We have a 9% vacancy rate at the level of house officers. The problem we have is at the upper levels of junior registrars, SMO, consultants, and registrars. Because in the past, there was absolutely no succession planning to take the house officers up to the level of junior registrars, consultants, and so on. And that is what we are now doing. Because the statistic, you see, there's a management concept. You cannot manage what you cannot measure. So just to come with anecdotal evidence is not enough to educate the public. So, what are the vacancies at the SMO level and consultants level? In 2015, it was 31%, has gone down marginally to 27%. Not good enough. Registrars, you had your turn to speak. Registrars, 2015, 44%. It has actually gone up a bit in 2016 to 51%. This is the data. Based on that data, we now have to put plans in place to migrate our junior doctors, our interns, our house officers, up to the level of SMOs, consultants, and registrars. And one of the reasons for these bad figures is because over the past 5 years, there was no succession planning. And we are fixing that. The Ministry of Health and the Service Commission Department, we have already started to work to fill the vacancies on the establishment. Those permanent posts, we have started to work to fill those vacancies. Example, medical officers, pharmacists, medical lab techs, staff for public health, and all allied health. You see, my focus, unlike yours, which is just doctors, my focus is on the entire healthcare system. You spent 9 minutes talking only about doctors as if it takes doctors alone to run a public healthcare system. I am talking about we are going to fill some of the vacancies for pharmacists, so when the doctors write a prescription, there's somebody to dispense the prescription. And the Service Commission Department comes into the Ministry of Health in 2 weeks. So let me tell the public and tell you, Madam Speaker, the Service Commission Department comes into the ministry in 2 weeks to start filling these vacancies. The mess that they left behind, we will fix that mess.
Member.
The RHAs
Member,
are all...
1 minute, please. Member for Baratari San Juan. Member for Baratari San Juan. There's a particular way, and could you please abide by the standing orders? Thank you.
What are we doing specifically for the doctors to migrate them from the junior levels to the senior levels? The University of the West Indies has the DM program, which will tackle...
What standing order are you referring to, please? Member, could you please continue, member for St. Joseph?
Thank you. So the University of the West Indies DM project will start to train internists, people in psychiatry, radiology, general surgery, ENT surgery, ophthalmology, anesthesiology, and accident and emergency medicine. There are other areas for postgrad training in neurosurgery, pathology, and oncology. Madam Speaker, the mover...
48-1, the question was asked about the 150 doctors.
Member for Naparima. Member for Naparima. There is a particular motion that is worded in a particular way. I overrule you on relevance. Please continue. Irresponsible.
So, the honourable member for Caroni East, Madam Speaker, said, why not take, so I'm coming to your answer now. He said, why not take these 150 doctors, these junior doctors, and put them in the Couva Hospital? Madam Speaker, could you imagine inflicting on this country a tertiary health facility run only by junior doctors, by interns? Madam Speaker,
Member for Baratari Samo. The next occasion, I'd ask you to please leave the chamber.
So, my learned doctor friend wants to take 150 interns with babies' milk in their face still to run. You said, why not take them and put them in Couva? You cannot do that. You can't. And this is where I say they have been loose with the facts. And let me tell you why. In Couva, they specifically asked me about Couva. Let me tell you some of the services, Madam Speaker, about Couva. Pediatric infectious diseases services. Do you know how many doctors we have in Trinidad who can deliver this service that they were going to do in Couva? None. Pediatric nephrology and dialysis was going to be done in Couva. Madam Speaker, do you know how many of those subspecialty practitioners we have in Trinidad and Tobago? None. Pediatric gastroenterology. Do you know how many pediatric gastroenterologists we have in Trinidad and Tobago that they were going to put in Couva? None. Pediatric dermatology. Madam Speaker, do you know how many pediatric dermatologists we have in Trinidad? None. But that is how they were going to open the Couva facility. They opened it. Oh, sorry, you opened it. You opened it. You commissioned it. Do you know, Madam Speaker?
Member for Naparima, this is the last warning.
Do you know there is no pharmacist attached to the Couva Hospital? There's a vacancy because we're talking about vacancies. But do you know why? The pharmacy in Couva Hospital doesn't have a license to operate. No. It doesn't have an aspirin. It doesn't have a Panadol. But they commissioned the hospital on August the 14th, 2015. Madam Speaker, there is no one in Couva. There are vacancies in Couva to operate the incinerator. But worse than that, there is no incinerator. So we now have to find a way. Is it that we are going to take the medical waste from Couva and send it to San Fernando? Because they didn't get the certificate of environmental clearance to build the incinerator. So they build the hospital without the incinerator, so there is no incinerator, and there are vacancies for people to run the incinerator. Madam Speaker, there are vacancies for people in Couva to operate the wastewater system.
Irrelevance to the motion.
Hey.
Come on.
Member for Caroni East, I overrule your objection. Please continue.
If it hit you in the face, it would
So, Madam Speaker, in talking about the vacancies, there is no wastewater system when they commissioned the hospital on August 14, 2015. Do you know that? What were you all going to do with the wastewater? There's a vacancy to operate the wastewater system. And they started, and the Unicot, and the yes, there was no wastewater system.
Member for Caroni East. Please continue.
Yes, so in wrapping up, Madam Speaker, because my time is coming to an end, for Couva, they have absolutely no specialist to run the pediatric department in Trinidad and Tobago. There is no pharmacy, there is no pharmacist, there is no pharmacy license, there is no incinerator. There are vacancies to run the incinerator, but we have to decide whether to build the incinerator now, and there are vacancies to operate the wastewater system. Madam Speaker, I thank you.
Leader of the House.
Thank you very kindly, Madam Speaker. I beg to move that this House do now adjourn to Monday, the 25th of April, 2016, at 1:30 p.m. Madam Speaker, at that time we'll be doing motions 2 and 3 that now appear on the order paper. And Madam Speaker, I would like to indicate, as I have indicated to the acting chief whip, that we will be asking to take those two matters together.
Honorable members, before I put the question, notice has been taken of a developing practice of members to place heavy reliance on voluminous notes, and members would be asked to take notice of the relevant standing order 4410. Honorable members, the question is that this House now do adjourn to Monday, 25th April 2016 at 1:30 p.m. All in favor say aye. Aye. Any against? The ayes have it. This House now stands adjourned to Monday, 25th April 2016 at 1:30 p.m.